Hello, everyone. Welcome to week 7. I'm just going to give you a brief mini lecture on chapter 7 that focuses on understanding health insurance. I hope you're enjoying the presidential and vice presidential debates. They're quite stimulating. In general, I'd say they're sticking to the issues. There's some punches being thrown, but in general, they're sticking to the issues. And pay attention to the health policy related comments that both sides are making and try to see how they relate to our course if you get a chance. All right, so this week we're talking about how health insurance operates and talking about managed care. With regards to health insurance coverage, what you really need to know is that we have a substantial number of people who are uninsured. When we talk about the uninsured, we don't include people over 65 because they usually have Medicare. So we talk about non-elderly people being uninsured. So that means everyone under 65. And about 1 in 5 people are uninsured currently. That's obviously not where we like to be as a nation. It's a bit unacceptable. Other developed nations are not don't have such a high rate of uninsured people, and of course this has an impact on these not only these individuals and their financial situations or states, but it also has an impact on our economy as a whole. And it's something that we've been attempting to deal with for decades now. And we hope the Affordable Care Act will at least get some of these numbers down if if the Obama administration is allowed to fully implement it, or if Romney comes in and he actually implements the insurance provisions of the ACA. All right, so most Americans have health insurance. You should just be aware of that, mainly through their employer, and that includes state and federal employers. About 60% of health insurance in the nation is paid for by the federal government. And when you hear that figure, you have to wonder, well, how is that possible? How is the federal government paying for so much of this? And how did I not realize that the majority of health insurance in the country is being paid for by the federal government? And one reason you don't realize that is because that number would include state employees. Remember that taxpayers are paying for the health insurance of state employees, right? And also federal employees. So their money, the money we're using for their health insurance, is coming from us, right? It's coming from taxpayers. So just remember that that is essentially government money. That's taxpayer dollars being used to pay for their health insurance. So we've got all this huge workforce out there, millions of people that are receiving tax dollars to take care of their health care. And then we also have Medicare and Medicaid, and then the military, and of course our vets, right? So remember, for vets, not all vets receive health insurance. Only some of them actually qualify for health insurance. You actually have to go through a whole process of figuring out whether or not you meet the standards for VA health benefits or not. But all of these together make up government finance health insurance. It's not all government run. Government run is an improper term. Government run would imply that the government controls not only financing but also the providers. But government only finances all of these types of health insurance. The only providers that it controls are for the military and for the VA. Otherwise, it doesn't control providers. We have private providers, and we have government financing. Of course, we have private financing too, and the majority of Americans have privately financed employer-sponsored insurance. Okay, some of the basic terminology. One related to insurance is one, beneficiary. That just means you, the person with the health insurance plan. You're the beneficiary. You're the one benefiting from the plan. Premium is an annual. Is a monthly fee that you pay, but if you total it up for every month, of course, it can be called an annual fee also. But most people think of it as this monthly fee they pay in order to keep their health insurance active. A deductible is the amount of money you would have to pay before you can access your health insurance. Big deductibles are great for people who are healthy, who don't really need their insurance that often, and they also can save money. But for people who use their health insurance quite frequently, you really need a small deductible because you don't, or no deductible at all, because you don't want to spend a lot of time paying out of pocket before you can actually access your health insurance. So you don't need a $4,000 deductible because you'd have to come out of pocket $4,000 before you could get to the health insurance. All right, cost sharing is just another way of pushing some costs over to consumers. So when you go in to see your doctor, you might have to pay a certain percentage of the fee yourself, and then the insurance will pay the rest, and that's called cost sharing. And you can have a co-payment or co-insurance. Co-payment is a set amount of money. Co-insurance is a certain percentage of the cost that needs to be paid. Now, when we think about insurance, you have to realize that insurance is really all about preparing you for any risk that you don't know about. So there's a level of uncertainty and there's a level of risk involved in insurance. Insurance companies spend all their time trying to figure out what the risk will be to their company. You're trying to figure out what the risk will be to you. So the goal for you is to really calculate what are you truly going to need, and you just do the best job you can at trying to predict that, and then you buy the insurance plan that or you purchase, or you and your employer purchase an insurance plan, hopefully that will actually meet your level of risk. Now, sometimes you don't have many choices from your employer, so you just have to go with what's out there. But hopefully, if your employer is savvy enough, you at least have a couple of different choices to select from, or the one choice you have is actually solid and is a good choice for you. All right, there's this concept called adverse selection that the book points out, and that concept is really just focused on the notion that people who are really sick will be interested in purchasing health insurance, and they're more likely to purchase a lot of health insurance. So they're going to not only purchase it, but they're going to use a lot of it. So insurance companies are not so interested in providing insurance to these people because they will use a lot of the services, and that means that health insurance companies will have to pay out a lot of money for these individuals. So that's why it's called adverse selection. It's adverse to the insurance company. It's not adverse to the person. So adverse to the insurance company, adverse selection. All right, now with regards to setting premiums, insurance companies use two major ways of setting premiums. They look at the experience, so they look at your current health status and your past medical records to figure out what they should charge you. And what they're trying to do is predict how much insurance you're going to use in the future based on your past information. Or they can use community rating, where they really just look at an entire community and look at some basic information not related to what your medical history is or your current health status, and they try to come up with a basic rate that they're going to charge all people within that community. And that's the approach usually used for large group plans that you get through a large employer. So if you work for Pfizer, the insurers that they work with would use community rating. All right, so the book points out that this law called HIPAA, Health Insurance Portability and Accountability Act, offers some benefits to people with a group health plan. So HIPAA prevents group health plans from taking pre-existing conditions into account when determining whether or not someone's eligible for insurance. The ACA expands this to all types of insurance. So you might ask, well, what is the other type? The other type of insurance is an individual plan. So you can have group plans that are for these large groups and large employers, and then you can have individual plans, which are just for any Joe Schmo out there, any person who wants to buy health insurance can go to an individual health insurance company and purchase a plan. All right. So HIPAA also guarantees that these group plans cannot charge different premiums based on your health status, and those two things really do go together. Now, when we think about managed care plans, managed care really was created because of the fact that costs were really growing in healthcare and getting out of control, and there was no approach by healthcare providers to try to keep costs down and to find ways to prevent people from using healthcare unnecessarily. So business people stepped in and they came up with an approach to keep the cost of healthcare down. This notion of managed care. And so managed care is really focused on finding ways to either lower what's being paid out to healthcare providers or decrease the amount of health insurance the amount of benefits being used by patients. And so, as I have here, there are only really two major ways to cut costs in healthcare, and that's either pay less, so pay out less to various health providers or maybe drug companies, or to use less. So if you just use less stuff, you get somehow you make the society healthier, and you decrease the amount of healthcare services that they use, and they're going to spend less on healthcare, and insurers are going to spend less on healthcare. So those are the major two ways to cut the costs of healthcare. And so some of the techniques used by in managed care companies to decrease payouts to providers are performance-based salaries. So they'll pay a certain salary, and then if you find a way to keep costs down, they may give you a bonus for doing that. So they're trying to incentivize you to actually keep their payments down, which makes sense from a company perspective, right? Or they offer discounted fee schedules, and unfortunately, these companies really do have a disproportionate amount of power when it comes to bargaining with individual physician practices or group physician practices, so that they are able to set rates sometimes so low that it is just almost unfair to the providers to accept this rate. However, if the providers work in an area where a certain managed care company dominates the region and most employers use that managed care company, like Kaiser in California, then the healthcare providers have to take that agreement with the managed care companies and just try to find a way to make a living off of it. And so what you see as a result of that is that a number of individual physician practices and group practices are now selling their practices to really large healthcare centers, because those large healthcare centers can actually negotiate with the managed care organizations much better than the individual or a small group physician can. They just don't have the capabilities to negotiate with these larger managed care organizations. And then there are capitated payments. A capitated payment is really a lump sum of money given to providers and in order for them to provide care to a certain number of patients. So the providers have to figure out, well, how much money would it cost me to treat a certain, standard panel of patients in their region. Then they have to come up with what they think their profit should be and their revenue should be, like the cost of their labor and so on. And then they try to negotiate a certain amount of money or a certain rate that or I should, sorry, a certain lump sum that the managed care company should pay. And of course, the managed care company will do the same thing, and they'll come up with a figure that they think is correct. And then they'll just kind of hash it out and figure out what that amount of money should be. So let's say a provider might get $1 million to treat 2,000 patients for the year. And the provider in that situation is incentivized to try to decrease the amount of services that are offered, so that at the end of the day they can actually take home more money from the managed care company than they're actually spending. So just imagine if somebody gave you $1 million for the year, and they said this money is for you to take care of your household and your family, and anything left over afterwards is just your money for yourself to do whatever you want to do. Instead of you using the entire $1 million, you would probably try to find ways to keep your costs as low as possible, so that then you could actually take home some of that money. You could actually save it and maybe do other things with it, invest it, and so on. And that's the same situation for these providers. But what happens as a result is that sometimes providers actually end up offering less services that can lead to actually harming patients. We really need some balance between these kind of negotiated arrangements with providers and the other approach, which is called fee for service, which means physicians just get paid for every little thing they do, every service they offer to you, they get paid for. That tends to lead to increased costs, and that system is the reason that managed care exists today, because businesses were trying to keep down the cost that physicians were charging through a fee-for-service system. All right, now some other ways of keeping costs down are by, as I said before, using less. So gatekeepers are primary care providers that really determine if you need to see a specialist or not. And they may determine that you don't need a specialist and that they can take care of whatever your healthcare needs are in different situations. And in that case, they would keep the costs down because primary care providers are a lot cheaper than going to see a cardiologist. So they can really lower costs by serving this gateway or gatekeeper function. Utilization reviews from managed care companies take a look at what providers are doing and then try to adjust the behavior of the providers in a different way in order to save money. And case management is somewhat similar in that managed care company might take a look at a certain patient population, let's say children who are obese, and they might figure out, well, the typical obese child needs 5 different physicians to or other types of healthcare providers to help them lose weight, and the managed care company might come up with some easy way for all those people to talk with each other and provide a streamlined approach to care for that obese child in order to make them less obese and improve their health status. All right, so the final slide here is focus on different types of managed care structures. So we have HMOs, which are quite popular, especially in certain parts of the country, and at this point fairly well known by the general society. And they're not they're not the most well liked type of managed care organization. But they are effective actually at keeping costs down. And the way they do that is by limiting the providers that a beneficiary, you as a person or a patient, can see. So you can only go within their network of providers. If you go outside that network, then you get charged an extra fee. And in some cases, they may not pay anything. You might just have to pay it all on your own. So you're very strongly incentivized to stay within your network. Preferred provider organizations are similar, but they actually allow you to go out of network for certain types of fees, and they offer a discounted fee schedule for providers. So they try to, cut down on your utilization, and they try to cut down on the amount of that they pay out to providers up front in order to make sure the providers are focused on providing you with just the things that you need. Then point of service plans are kind of a mixture of preferred provider and health maintenance organizations, in that they have a gatekeeper just like health maintenance organizations have. Health maintenance organizations have a gatekeeper to keep you within the network, and if you try to go out of network, they generally don't approve of you doing that, so you'd have to pay on your own. But in a point of service plan, you can actually usually use out of network uh, or an in-network approach if you want. It's sort of up to you. Out of network has usually limited uses, so there are limited types of out of network providers you can go to. Often it's because they offer a certain service that you can't find within the network. Okay, so that's the end of the mini lecture for this week. Let me know if you have any questions or concerns about health insurance. Again, this is a mini lecture, so there's a lot more that I could discuss and talk about. And I look forward to seeing your comments in the discussion section and your debates and commenting on those during the week. All the best. Bye.